Now let's talk about cardiovascular disease and heart failure. When you think of someone who has congestive heart failure, you think of someone who is perhaps in their 70s or 80s. In fact, this disease covers a broad range of ages. 1 in 4 men and women have some form of heart disease. Dr. John Strobeck is co-founder of the Heart Failure Society of America and medical director of the Heart-Lung Center in New Jersey, and a very highly credentialed cardiologist. Welcome, John. Thanks for being with us.
Thank you.
What is out there right now that not only helps in the treatment of congestive heart failure, but can assist doctors in aggressively treating hypertension and coronary artery disease so that they don't get to the final stages of heart failure?
Well, thank God there's a lot, David.
Yep.
And we're fortunate to have at our disposal now many new treatments, many new methods of diagnosis, one of which has been the sleep study, which was just referred to. Many people who have heart failure also have abnormal sleep patterns, and sometimes we don't find out about it until we do a sleep study. But I'd like to focus today on some new technology that's being utilized both in the hospital, but more primarily in the outpatient or office setting, that derives from some NASA spin-off of impedance or bioimpedance measurements of internal body function. And this particular device, which is called the BioZ, which Z refers to the impedance.
Meaning like resistance.
Resistance.
Okay.
Utilizes a measure of the internal resistance of the chest and how that resistance changes during cardiac action to actually measure some of the important hemodynamic parameters that we normally reserve our measurements to in the hospital using invasive methods such as pulmonary artery catheters and things like that, but helps us now to get information about the process of disease that allows us to intervene early, see if there's been progression from one time period to another, and helps us really understand the severity without forcing that patient to go to the hospital.
So, you know, I'm a little slow, so work with me here. The BioZ, is this a non-invasive procedure? Just give me a quick...
This is a very straightforward, non-invasive procedure involving the placement of 2 pairs of electrodes on the neck, another 2 pair on the chest, and through an elaborate mechanism of current passage and then resistance measuring, this is able to derive exactly how much blood is being pumped by the heart every beat.
Wow.
And as a result, we can calculate all of the internal hemodynamic parameters that we normally use to measure not only the severity of the problem, but also to monitor the course of our treatment. We can tell if a person is getting better using certain drug treatments. We can titrate the drug dosage in order to obtain a better overall heart response, all in the office.
So by hemodynamic, you've used that a couple of times. What you're saying is the dynamics of blood or the movement of the blood. Would that be a fair way to characterize that? All right, now look, I come in to you as a patient and we put on the BioZ device, and all of a sudden you say to me, David, you've been leading the wrong lifestyle. We see all kinds of problems. At that point, is it too late, or can you suggest things that we can do?
No, the BioZ does not lie. It can tell us when you've been in the left lane too long, but it also helps us to again, make a decision whether you've got too much fluid in your body. Maybe that's the reason for you feeling fatigue or short of breath. Maybe you don't have enough drug in your body that relaxes the arteries and creates vasodilation to help keep the blood pressure low, making it easier for your weak heart to pump. So it really helps us fine-tune and focus the treatment so that we end up keeping you feeling well, keeping you stable for much longer periods of time, and we believe actually slow the progression of heart failure.
You know, that was absolutely brilliant.